Making sense of the IVF success rate. One of the commonest questions which patients ask is, what are my chances of getting pregnant? What's the IVF success rate? And obviously it's such an important question because everyone knows the success rate is not 100%, that IVF is expensive treatment, that you may need to repeat it again, and that different clinics have different success rates because not all clinics are equally good. Therefore, selecting the clinic which has the highest success rate is common sense because that's how you can maximize your chance of getting pregnant. The problem, of course, is that while we talk about success rates, it's a simple question, isn't it? But the answer is surprisingly complex. The simplest way, of course, is just to quote a number. And the beauty is lots of clinics quote any number they like. Ridiculous numbers. Oh, our success rate is 60%, 70%. The problem is that you can quote anything you like in this country and no one can hold you accountable. No one asks you to prove your figures. No one is tracking your statistics. And which is why everyone now plays this inflation game. So which means when one clinic claims 50%, someone else claims 60%. And they're lying through their teeth. But there's absolutely no way patients can find out what their actual success rates are. I think equally important, you need to understand that success rates apply to groups of patients. They don't apply to individuals, and you as an individual don't really care about what's happening to the other 99 patients in the clinic. You only want to know what are your chances of getting pregnant. Which means if a 25-year-old with blocked tubes does IVF and her success rate is 50%, that's no joy to you because you're 40 years old and your chance of getting pregnant is only 10%. Which means ideally the clinic should provide a success rate which is tailored to your particular clinical context, which is hard to do because often doctors don't want to tell you the truth. They're so keen on getting you to do an IVF cycle that they will tell you all kinds of inflated figures and you have no way of finding out whether they're telling you the truth or whether they're lying to you. So you definitely need to ask these questions. You also need to interpret the answers and you also need to accept the fact that a lot of the answers are just going to be plain lies and you can't do much about that. Fortunately, in the US, there are organizations which actually track success rate figures which are authentic because clinics need to report this on a regular, ongoing basis. Hopefully, at some point, Indian IVF clinics will start doing that too. But right now, you're pretty much forced to take a leap of faith. I think you also need to ask yourself another question is that, what are your chances of getting pregnant if you do nothing? Which means, let's suppose your tubes are blocked. Let's suppose you're 40 years old and you go to a doctor and the doctor says your chance of getting pregnant with IVF are, let's say, 10% because you're older. It still makes a lot of sense to try doing that IVF cycle because 10% is better than zero. And the reality is that whether or not you get pregnant, at least you will have peace of mind that you tried your best. That peace of mind can be invaluable because as you grow older, you realize that you very rarely regret the things in life which you do. You often regret the things you don't do, which means if you've done your homework, gone to a good IVF clinic, given it your best shot, had your embryo transfer and still not got pregnant, at least you will know that you did the best possible. And really, what else can an IVF patient do? What else can a human being do? And if you have questions, you can always reach out to me. Please feel free to ask me. I'm Dr. Malpani. Our website is www.drmalpani.com and I'm happy to offer a free second opinion. So I look forward to trying to help you to have a baby.